Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks, the podcast, is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.
Good morning, Victor.
Good morning.
How are you today?
Doing fantastic.
Great. So we're here today to talk about Building Blocks, the journey of the first 1,000 days. And I'm wondering, probably can't remember back to the first 1,000 days, but thinking about a relationship or somebody in your life that you know now was really impactful for your first 1,000 days.
You know, I think it's such a great question because when we're thinking of building blocks, we're really thinking about those familial units or those close family friends that really had an impact on your life, especially in those early stages of life. And so for me personally, I'm very fortunate that I had a very robust, loving family life. My entire family is from Northwest Indiana. My grandparents immigrated from Mexico, and so family is very important to our culture. And so I can't answer that question for you because the answer is my entire family. I mean, the impact that my family had on the early years of my life really defined who I am. But I will share this. My parents really instilled in me a sense of giving back. And that sense is what drove me to pursue a career in the for-purpose sector. And so really the work I do and my own personal mission statement of making Northwest Indiana better today than it was yesterday was really instilled by me, by my parents.
That's wonderful. We know it just takes, just that robust ecosystem of care and love and support that makes such a difference in the rest of our lives. So here you are today. Tell us about the work that you're doing right now with the Food Bank of Northwest Indiana.
Sure. So the mission of the Food Bank of Northwest Indiana is to feed people today and end hunger tomorrow by inspiring and collaborating with our community. And I like to hone in on that, inspire and collaborate with our community, because that's really where the bread and butter of the work that we do in Lake and Porter counties come through. So identifying ways that we can have an impact on bettering the lives of our friends and neighbors in Lake and Porter counties through nutrition. And so I say that because oftentimes when people think about the Food Bank of Northwest Indiana, they're thinking about maybe our mobile distributions where we're bringing a truck out to a sector of the community, or maybe they're thinking about our partner agencies, those food pantries and soup kitchens and community feeding areas that we are supporting. We distribute about 8 million pounds of food every year and continue to grow that as the need continues to grow for emergency food supports. But I want to hone in on something. We don't really think of ourselves as a charitable food organization. We think of ourselves as a public health organization because we can't have a healthy community if we don't have proper nutrition.
I was reading recently that about 85% of deaths are related to nutrition-related diseases. So those things that underlying causes. So talk a little bit about that food and that nutrition need that is so critical to our public health.
Yeah, so there's a few ways that we impact that at the Food Bank of Northwest Indiana. We know that we are currently serving, on average, about 60,000 Lake and Porter County residents each and every month. That's 60,000 people that are impacted by our programming. And unfortunately, we all know this, right? Calories are cheap. It's really easy to get calories. You can go to a corner store and get calories. You can go anywhere in the region and get calories. What's difficult to get is nutrition. And so identifying ways that we can leverage USDA programs like the Emergency Food Assistance Program or the Commodity Supplemental Food Program, which are bringing really nutrient-dense products from American farmers to our communities is critical. But aside from that, we also have food as medicine programming. So we have specifically medically tailored grocery programs, and our initial launch was to work with having an impact on infant and maternal health, primarily wanting to reduce the infant mortality rates in Lake and Porter counties. We've got programs built for promoting better health in terms of heart disease, and we have programs for diabetes. And I'm really excited to mention this, that in the start of quarter one of 2025, we'll be partnering with the Lake County Health Department to do a medically informed box to promote mental health. So we're really excited about this new partnership that we have.
Tell me a little bit more about that. What are some of the foods that you might find in a box that is really going to support mental health?
Yeah, so we're looking at the fatty acids. We're looking at kind of the fish products, right? So all of the products, and here's the secret. I'm going to tell you a little bit of the behind the scenes, right? It's no surprise that nutrient-dense fresh produce is going to be the answer and the building block, if I may, with each of these various programs. So all the things that we've been taught since we were children on how to eat healthy are going to impact these underlying health conditions, including mental health.
That's amazing. So specifically, am I going to get my avocados in there and some, green beans? What am I going to find in a box like that?
So we are very fortunate. We are working with our healthcare partners, and this is the unique thing that we do at the food bank. So we are not experts in healthcare. We're experts in sourcing and distributing food. So we rely on our partners to tell us what they would like their patients to be consuming. And so that answer might be a certain menu for box A with a specific healthcare partner, but a similar program is going to look completely different with a different healthcare partner based on what the dietary guidelines and nutrition needs are for that specific patient.
So it sounds to me like you're really kind of busting some of those old time. This is not your grandmother's food bank, right? We're really changing up, or you're changing up the way that we get nutrition to families and to individuals by working with those partners who have that level of expertise. I want to talk more about this box for that infant mortality. Like how does the idea of healthy food and nutrition impact keeping a baby alive through their first birthday?
Yeah, so that's a great question. And what we did is we knew we can have an impact on infant mortality rates, which we all know how horrible our infant mortality rates are in Northwest Indiana and in the state of Indiana compared to our peers in the country. So we went to our partners at Franciscan Health and said, if a woman was pregnant and food insecure, what would she be eating to have a healthy pregnancy? And they built out a menu for us. And so we built a program with their prenatal assistance program and said, okay, if a woman shows up to the hospital, is pregnant, and is on Medicaid, we know she's food insecure. So we're automatically enrolling her in this program that provides assistance through home visiting programs like Healthy Families, Parents as Teachers, Nurse Family Partnership, but then also is providing nutrition support through the food bank. We're bringing that box of groceries to the hospital so that when mom is showing up to the hospital for her visit with her provider, she then is going home with her box of groceries while also getting support from her home visitor on what to do with those groceries, right? So the key here is when we're talking about the programs we're developing at the Food Bank of Northwest Indiana, we try to really focus in on the lens of social determinants of health, and then with children's programming, adverse childhood experiences. So we really want to have kind of a trauma-informed, a more meaningful impact. And that's part of that mission statement of, yes, we need to feed people today, but how do we end hunger tomorrow? And in our opinion, ending hunger tomorrow means that we are all self-sufficient. right? So we have access to good paying jobs. We have an opportunity for an education. We have the ability to get to work because we're not sick. And all of that starts in that 0 to 3 age, right?
Absolutely.
So if we can hone in on that 0 to 3, 0 to 5 space and really make that the best experience possible for that child, we will see the benefits as a community later in life.
I couldn't agree more. Thinking about the mental health aspect and thinking about, being a pregnant woman and anticipating the joy of having a child, but also knowing how challenging that is. Tell us a little bit about the impact that has on a woman or a family's mental health when they find themselves to be in a situation that they live in a food desert, or they're food insecure, or nutrition, they don't have that security of nutrition. How does that impact one's mental health?
Yeah, if you have children, put yourself in those same shoes. Remember back when you were there. I have 2 children. I remember what that was like and how scary it was. You have this baby, and then the doctor says, here you go, and go home, God bless, have at, right? Now, we're fortunate in our family that we had the resources and the support to be able to take care of our children. So as scary as that was, and as mentally draining as that was, I had the support system around me to do the best I could. But not all of our friends and neighbors in Lake and Porter counties have those same support systems. So being able to alleviate even some of the stressors of being a new parent really has a significant impact, and that reduction of a stressor will carry down to the child as well, as we're talking about adverse childhood experiences. So having access to food, look, it's Maslow's hierarchy of needs, right? We need food, we need shelter, we need safety. Then we can worry about everything else, right? So if we can eliminate or maybe at least mitigate part of that stressor, that will just help a parent be the best parent that they know they want to be anyway.
Absolutely. Again, I couldn't agree more. And when you think about, wrapping our arms around all of the babies born across Northwest Indiana, starting with food is so critical. I know you have a background in this area, so your passion for this is even deeper than providing nutrition for families and partnering with healthcare providers. Tell us a little bit about your work prior to coming to the food bank.
Yeah, sure. So I'm a recovering banker. So I started my career in financial services and found myself volunteering pretty regularly for the March of Dimes. And if you're familiar with the March of Dimes, they're really focused on infant and maternal health, and found an opportunity to become the division director for the Indiana chapter of the March of Dimes here in Northwest Indiana. So I made the shift from for-profit work into for-purpose work by coming over to the March of Dimes, and really enjoyed my time with the March of Dimes serving Lake Porter, Jasper Newton, and LaPorte counties. And after working there for some time, there was an opportunity to transition to Mental Health America of Northwest Indiana, and I was the vice president of strategic partnerships for that organization. And so most of my career has been in infant and maternal health and looking at that 0 to 5 time frame. So really looking at how can we do programming from a preventative side? Because the challenge, I wouldn't say is just in Northwest Indiana, but just in our country, is we really are great at trying to fix a problem. We're not great at trying to prevent a problem. And so even financial resources, you'll easily find ways and grants and funding to say, oh, we have this issue here, let's try and fix it after the fact, as opposed to finding resources at that 0 to 5 range where we can prevent a lot of those same challenges. And so that's really been a lot of my focus in my career, is how can we have a more meaningful, deeper impact that's going to create generational change, where we might not see the fruit of our labor and the investments we're making immediately, but our community as a whole is going to see those investments and how they change who we are as a community and who we are as a people in Lake and Porter counties down the road.
So I work with an organization called First Things First, and it's really about taking care of those first things first, basic needs, health and nutrition, just making sure that babies get what they need from the very, very beginning. Tell me, is there a success story, or is there a story you can share about a family that's received these prenatal nutrition or postpartum nutrition boxes?
Yeah, so we've heard from our healthcare partners that this box program really alleviates mostly some of that transportation barrier. And so being able to access this program, we have very robust mobile distributions. You've seen it on TV during the pandemic. A truck rolls up and we're distributing food. Prior to the pandemic, we were doing 2 mobile distributions a week, serving about 4,000 people a month. During the pandemic, we were doing about 6 a week, serving about 14,000 a month. The last 2.5 years, we've been doing 5 a week, serving about 12 to 13,000 a month. So there is a lot of access points for that mobile distribution should a family need a little help and get some groceries. We also have around 130 partner agencies in Lake and Porter counties that have food access points. Here's the challenge, though, as we're talking about social determinants of health, is a lot of the families that are enrolled in a program like the prenatal assistance program, they are struggling just to go see their doctor. So being able to provide that food support right on site and not say, okay, we know you need some additional food supports, now go down the street here or now go there, when they might not be open, or family may be working 2 jobs or working shift work and just can't access that grocery support. So we've received numerous feedback on how, 1, the quality of the product, but 2, that we make it easy to access this support. And one of the really cool things we're doing with HealthLink in Valparaiso is we're one of the first food banks in the country to leverage automated refrigerated smart lockers. And so our Valparaiso HealthLink project is a food as medicine project. It's not necessarily geared towards infant maternal health. That one's more geared towards heart disease and diabetes, but it's a similar concept in a way that we can mitigate that transportation barrier and really provide that support when it's appropriate for the patient or our neighbor, instead of saying you need to come when we're open.
Of course. Talk us through that process. So storage, food locker, all of these things. What does that look like? How do people access that? Give me the process of how that happens.
Yeah. So it's called our Order Ahead Smart Lockers. You can go to orderahead.org and you can register online, and you can see which of lockers in Northwest Indiana are available, and you schedule a day and time to pick up your groceries. All of our lockers have different programs, but the easiest way to think about it is picture that automated locker you might see at a grocery store or a retailer to pick up maybe a distribution or something that was going to be shipped to you. It's the same concept. It's a locker system. Ours are refrigerated, and so when you enroll in the program, you get a QR code or an alphanumeric code if you don't have a smartphone, and you just go up to the kiosk, scan your phone. It tells you Bay 12 is open. You open Bay 12, pull out your groceries, close the door, off you go. And so the advantage there is for our families that United Way would call an ALICE family, those asset limited, income constrained, employed. What I like to say is folks who are working and are just struggling to get by, this is a great solution for those families because, again, they might be working 2 jobs. They might be working shift work. They might not be able to get to a mobile distribution or a food pantry when they're open. But with the smart lockers, they get to pick when they're picking up their product. So if that's at 2 in the morning, if it's at 5 in the morning, if it's at 2 in the afternoon, it's what's appropriate for their family.
That's, again, individualized, really thinking about the dignity of the family, dignity of the individual, what that family needs in that moment. It's so empowering and so respectful. Are other communities doing things like this, or what is the intended outcome here? What do you see happening? How might you grow this? Is that your goal, to grow this?
Yeah, so we wanted to pilot out this new technology for a couple of reasons. One is we wanted to provide, to your point, that dignity and access point. But 2, most of the charitable food network is our food pantries and soup kitchens in our community. Most of them are houses of worship. Most of them are run by volunteers. And we have a concern that as the current volunteer group in those community organizations age out of volunteerism, that we're going to see a reduction in access points in the near future. So we wanted to test now on how can we leverage technology to supplement what is going to always be there, those food pantries and soup kitchens. But if they're maybe not open as many hours, we can't necessarily be efficient at bringing more and more trucks out to parking lots. So how can we leverage new technologies to satisfy what we do believe is not going to be a decrease in demand? We're always going to be needed. So how do we supplement that? So that was the start. We are one of the first food banks in the country as part of the Feeding America network of food banks to be operating this. There are a few other food banks that are doing similar work. However, I would say that we're one of the most successful in the country. We started with 2 lockers. We're currently at 5 lockers. So we have one in Maryville. We have one in East Chicago inside the Strachan Vance Hill. We have one at Edgewater Health in Gary. We have one outside HealthLink in Valparaiso. We just had a ribbon cutting on one at the Boys and Girls Club in South Haven, and then the Lake County Health Department will be launching one next year in Crown Point.
Congratulations. That's really amazing and such an innovative use of technology in this case. So again, if this is something that I would be referred to by my healthcare provider for this, and then I would be able to access that.
So with the smart lockers, the order ahead lockers, they're all unique. They're relatively expensive to launch. These are pilots, and so they all have different funding mechanisms, which means they all have different populations that they're supporting.
Okay.
So for the general public, the easiest one to say is the food bank in Maryville at 6490 Broadway. There is a locker there. That one is open to the general public. If you're at 185% of poverty level or below, just need to answer a few questions at the Order Ahead website and pick and choose a time to pick up your groceries. As well, the East Chicago locker in Strachan Vance Hill is an open locker. The HealthLink locker is a closed locker. That one is for their patients. So you would need to enroll in their program. The Boys and Girls Club in South Haven is an open locker. The Edgewater Health Program in Gary is a closed locker. We're looking to see if we can have an impact on folks in Gary who are experiencing homelessness through that program. And then the program in Crown Point, when we launch it, will be an open locker as well.
Amazing. I want to back up a little bit and just provide our listeners with some basic knowledge, because I don't know that I know for myself, I wasn't clear. You hear words like soup kitchen, food pantry, food bank. In some neighborhoods, there's little cute little houses that have, a shelving that there's canned food or things like that. Tell us kind of the difference in what the role the food bank plays in this kind of whole system of providing nutrition for our friends and neighbors.
Yeah, absolutely. Thank you for asking that. So the easiest way to think of our core business at the food bank. So we have our direct service programs, but our core business, what we do the best and the most of, is if you think of a food pantry as a grocery store and think of a soup kitchen as a restaurant, we're the supplier. So our job is to go get the food, whether that's government food or that's donated food or purchasing food. So we have a 75,000 square foot warehouse in Maryville. What that means is we can source product cheaper than a partner agency going to a local grocery store and buying retail. We can buy in bulk. We can negotiate pricing. We have 2 docks. We can accept product. And one of the unique things that we have is the ability to accept donated food that's being rejected from a local retailer. So I want to give you a quick example of what that looks like. We try to rescue food as often as we can to, divert it from the landfill, but also because we know friends and neighbors need food, and so let's not just throw it away. So we had a local retailer who recently had ordered a truckload of chicken thighs, and the retailer canceled the order. However, there was a snafu in logistics, and so that order was sent to the retailer anyway. Well, the order was canceled. Now they can't accept it. They canceled the order, but that truck driver needs to empty the truck because they need an empty truck to do their next delivery, right? So they call the Food Bank of Northwest Indiana and say, hey, I've got a truckload of chicken thighs. Can I bring it over? And of course, our answer is absolutely. And so now we're bringing in, that's about 25,000, 30,000 pounds of chicken thighs that we can put in cold storage and distribute out to our partner agencies. So again, thinking about how our job is to source the product that our food pantries, soup kitchens, and then our mobile distributions and direct service programs are then providing out to our friends and neighbors in Lake and Porter counties.
So I know we're heading into the holiday season, and there's a lot of, grocery stores and different organizations, community groups that are looking to support the work that you do. What is your recommendation to individuals or families or groups that want to support your mission and the purpose that you have?
So we often have people ask, well, can we do a food drive? And we love food drives. Food drives are great. However, we can buy food cheaper than you can. So if you're going to do a food drive, oftentimes we prefer you do a fund drive because we can really leverage the power of your dollar to get more food out to the community. However, we do love food drives. Now, right now, we have programs with Shrek and Vance Hill where you can round up your bill, and that money goes directly to the food bank. It is critical funding for our programming. Also, some of our retailers may have bags at a certain dollar amount, and that is going to go to either a local food pantry, soup kitchen, or to the food bank for us to distribute out. But I would say this, as fourth quarter is around, oftentimes people want to give back. They want to volunteer. They want to donate. They want to bring out some food. And I want to remind folks that food insecurity exists all year round. So while we appreciate November and December every year, I would encourage folks to remember that March, April, May, people are in just as much need. So while, yes, we are going to be distributing almost 7,000 turkey meals in November, we are going to have that same need the rest of the year as well. So consider either supporting your local food pantry or soup kitchen or the Food Bank of Northwest Indiana year-round. Year-round.
You're right. It doesn't go away. And we know babies are born every day. About 20 babies in Northwest Indiana every single day are born.
That's right. And one unique statistic that I think a lot of people aren't aware of is almost half of the live births in the state of Indiana are born to women on Medicaid. So about half the babies that are born in our community are born into families that are experiencing at least some food insecurity. So having access to our programming or WIC or SNAP, federal programs that can really bring really quality nutrition into the household that are, one, can be culturally relevant, but also can be medically relevant. We love SNAP and WIC programming.
Those are really important supports for this joyful but also really challenging time. I think, having a new baby in your home and your family is wonderful, but it's also, it puts a lot of stress and anxiety. And so this is one way that our community can, again, wrap their arms around all of those babies.
Absolutely.
Victor, tell me, if people are interested in learning more about the Food Bank of Northwest Indiana, where do they go? What do they look for?
Yeah, so just like everyone else is going to say, foodbanknwi.org, go online. We have a very robust website. One of the cool things is if you want to help, there's a space for you to help. If you need help, this is a thing we like to tell people. It's okay to ask for help.
Absolutely.
Oftentimes people are afraid or they're too proud to say, I need a little helping hand. But as we started the conversation at the very beginning, I was talking about that insulation I had with my family. We all need a helping hand from time to time. It's whether or not you have access to that helping hand. So please leverage the Food Bank of Northwest Indiana and our partners if you do need some help. Now, one of the cool things about our website is you can go to our pantry locator and you can put in your zip code and it'll show you all the pantries that are available in your area, even if it's outside of Northwest Indiana. And we have a very robust partnership with the Greater Chicago Food Depository and the Food Bank of Northern Illinois that serve the rest of Chicagoland. So if you're someone who maybe finds yourself in Calumet City or Lansing and now you're in Munster, all of those agencies are going to be on our map. So you'll be able to see where you can get some supports if you need it.
And the work that you do is amazing. I thank you and your team. They're incredible. And I really appreciate the way that you've approached this about providing nutrition, because we do know that is one of the building blocks that's so important to all of our children and their health for the rest of their lives. Before we wrap up today, is there any questions that I haven't asked?
So I don't think that we've missed anything here, but I I think that it's important to note that this is just the starting point in having conversations like this, right? There's still a lot of heavy lifting to do and a lot of work to do. So I'd encourage listeners to engage, whether that's engaging in volunteering or if you have the ability to share financial resources with a number of organizations that are impacting that 0 to 5 space. Really, I can honestly say we're unique in Northwest Indiana. Many other parts of the country and many other parts of our state, the for-purpose sector likes to play in their own sandbox, and we're unique in Northwest Indiana that we all play well together as for-purpose nonprofit organizations. So whoever it is that that you feel as a listener that you want to support, I would encourage that you support that organization.
And you really are out there and you're collaborating. We've heard that already with healthcare providers, with retail organizations, grocery stores, others who are doing the similar work, but all really just to make our community the healthiest that it can be. And we know healthy moms make healthy babies, and that makes a difference for the rest of children's lives.
Absolutely.
So, this is great. Thank you so much for your time this morning, and look forward to continue the conversation.
Absolutely. Thanks so much for the invitation.
Sure.
Legacy Foundation is Lake County's community foundation. For over 30 years, we've partnered with donors and nonprofits, focusing on youth development, the arts, the environment, health, literacy, and other causes that matter to you. We're committed to Lake County forever. First Things First Porter County is dedicated to supporting families, healthy beginnings, and quality early learning, ensuring every Porter County baby is born prepared for a strong start in life. Learn more at firstthingspc.org.
I have a very strong connection to other students. Everyone makes an effort to help each other. I'll remember the feeling of being here, the feeling that I was a part of a family.
Additional support for Building Blocks is provided generously by Tom Sorlis and Sue Eleuterio, as well as Porter County Community Foundation, serving Porter County since 1996.
Building Blocks the Podcast is a co-production of Lakeshore Public Media and First Things First Porter County. For more information on Building Blocks, including this podcast, as well as the television show, visit lakeshorepublicmedia.org/buildingblocks.